Welcome to Module 2 Drugs, Nomenclature, Classification, Administration of the course Pharmaceutical and Medicinal Chemistry. Part A of Chapter 2.2 is about types of pharmacodynamic agents and drugs acting on the central nervous system. The instructor of this chapter is Dr. D. Sravani, Assistant Professor in Chemistry, St. Joseph's College for Women, Autonomous, Visakhapatnam. Learning outcomes. By the end of this chapter, students will be able to comprehend the meaning and relevance of pharmacodynamic agents, identify and classify the pharmacodynamic agents, recognize the different types of drugs which act on the central nervous system. The contents of this chapter are pharmacodynamic agents, types of pharmacodynamic agents, and drugs acting on central nervous system. Coming to the first topic in this chapter, pharmacodynamic agents. What are pharmacodynamic agents? Drugs that regulate the biochemistry of the body are called as pharmacodynamic agents. Pharmacodynamic agents control the biochemical pathways of living systems through biological actions such as stimulating the occurrence of a desirable biochemical reaction, depressing the occurrence of an undesirable biochemical reaction, blocking a receptor completely to stop unwanted biochemical changes, inducing a new biochemical reaction with therapeutic goals, and stabilizing an existing biochemical reaction to the optimal level. The next topic in this chapter, types of pharmacodynamic agents. Pharmacodynamic agents selectively act on any system of the body. Based on their site of action, these drugs are classified as drugs acting on the central nervous system, drugs acting on the peripheral nervous system, drugs acting on cardiovascular system, drugs acting on the hematopoietic system, and drugs acting on the renal system. The next topic in this chapter is drugs acting on central nervous system. Central nervous system. Simply we call it as CNS. What is central nervous system? The central nervous system comprises of the brain and spinal cord. The major anatomical parts of central nervous system are brain, cerebellum, brainstem, and spinal cord. The central nervous system in the body is responsible for the transmission of information. The three broad functions of the CNS are take in sensory information, process this information, and send out motor signals. Drugs acting on central nervous system can play a significant role in the maintenance and in setting right disorders of the CNS. Drugs acting on the CNS are also termed as psychopharmacological agents. The drugs which affect the CNS are again classified into three categories: non-selective CNS depressants, non-selective CNS stimulants, selective modifiers of CNS. Coming to the first category of central nervous system, non-selective CNS depressants. Depressants are drugs which reduce or numb the activity of the CNS. These drugs depress the nervous system and exert their effect in a non-selective way. These non-selective CNS depressants are classified into anesthetics, sedatives and hypnotics, antipyretics, and analgesics. The first class of non-selective CNS depressants are anesthetics. An anesthetic is defined as a drug that causes a temporary loss of sensation with or without loss of consciousness. Anesthetics are broadly divided into two groups. Those are general anesthetics and local anesthetics. General anesthetics. These drugs produce partial or total loss of the sensation of pain, which may be accompanied by loss of consciousness. This state of insensibility is known as anesthesia. Diethyl ether, chloroform, nitrous oxide were used as local volatile anesthetics. What is meant by volatile anesthetics? Which means easily evaporated anesthetics. Those are used in olden days. Recently, fluorinated ethers, hydrocarbons such as suprane, ethane, flutane, fluorane are being used to overcome the problems associated with volatile anesthetics. Then coming to the local anesthetics. Local anesthetics are drugs that cause a state of loss of sensation locally or at a particular site of reversibly blocking the nerve impulses that transmit the feeling of pain at the particular area of the brain. Local anesthetic drugs are procaine and butamben. These are the structures of procaine and butamben. The next class of non-selective CNS depressants are sedatives and hypnotics. What is sedative? A sedative is a drug which produces mild depression, calms anxiety, and pacifies excitation without causing drowsiness. Hypnotic drugs produce a strong depression and also induce sleep. The sedative and hypnotic drugs are wide variety of chemical compounds which include barbiturates, clonazepam, acetylene derivatives, and aldehydes. These are the examples: phenobarbital and clonazepam. Then next class of non-selective CNS depressants are antipyretics. An antipyretic is a drug that restores normal temperature only in the presence of fever. When antipyretic drug is administered, it activates the hypothalamic centers, dilates the peripheral blood vessels, increases the rate of perspiration, causes the body to lose heat and thereby lowers the temperature. Antipyretics also have mild analgesic effect. The antipyretic drugs may be divided into three classes: salicylates, para-aminophenols derivative, para-zolone derivatives. Examples for salicylates are aspirin and methyl salicylate. Phenacetin and paracetamol are the examples of para-aminophenol derivatives. Antipyrine and aminopyrine are the examples of parazolone derivatives. Coming to the last class of non-selective CNS depressants are analgesics. Drugs that relieve pain without significantly impairing consciousness are called as analgesics. These are also known as analgetics. They act on CNS to decrease the sensation of pain. Analgesics are divided into two classes. Those are non-narcotic analgesic agents, narcotic analgesic agents. Coming to the first one, non-narcotic analgesic agents. The non-narcotic analgesics are antipyretic and anti-inflammatory painkillers. These drugs act centrally or sometimes peripherally by blocking impulse generation at the receptors mediating pain. Analgin and ibuprofen are some of the commonly used non-narcotic analgesics. These are the structures of analgin and ibuprofen. Then, narcotic analgesic agents. Opioid analgesics are called as narcotic analgesics. Opioids are a broad group of pain-relieving medicines that work with brain cells. Opioids are compounds extracted from the opium poppy plant. They are addictive in nature. Morphine and codeine are some examples of alkaloids that were isolated from opium gum. These are the structures of morphine and codeine. Then, coming to the second category of drugs acting on central nervous system, that is non-selective CNS stimulants. The drugs which primarily affect mental processes to improve moods are called as CNS stimulants. stimulants. These drugs are also known as psychoactive drugs. Based on clinical usage, CNS stimulants are classified into analeptics, anxiolytics, antidepressants, and psychotomimetic drugs. Coming to the first one, analeptics. Analeptic drugs excite the medullary centers when patients are in a depressed state and improve the metabolic activity of the brain. Analeptics are used for the treatment of certain respiratory diseases, post-anesthetic respiratory problems, circulatory failure causing low blood pressure, and overdose of barbiturates, analgesics, and central anesthetics. Caffeine and nicotinamide are examples of this type of drugs. These are the structures of caffeine and nicotinamide. Then coming to the anxiolytics. The anxiolytics reduce anxiety and stabilizes the mood. Anxiolytics include tranquilizers, relaxants, and antineurotic agents and mood stabilizers which act on the brain. Examples are diazepam and chlordiazepoxide. These are the structures of diazepam and chlordiazepoxide. Then coming to the antidepressants which elevate mood. Antidepressants drugs are used to treat patients who suffer from acute mental depression. These drugs elevate the mood and generally have no effect on normal persons. Fluoxetine and nortriptyline are the examples of this type of drugs. Then coming to the last class of non-selective CNS stimulants, psychotomimetics. Psychotomimetic drugs are used for mental illness. These drugs are habit forming if used repeatedly. These drugs should only be used under doctor supervision. Examples of these drugs are LSD, lysergic acid diethylamide, and mescaline. These are the structures of LSD, that is lysergic acid diethylamide, and mescaline. Then coming to the third category of drugs acting on central nervous system is selective modifiers of CNS. The CNS selective modifiers include both depressants and stimulants. They act selectively on a particular part of CNS. These are classified into four groups: anticonvulsants, antitussives, anti-Parkinson's drugs, and neuroleptics. Coming to the first selective modifiers of CNS is anticonvulsants. Anticonvulsants are a diverse group of pharmacological agents used in the treatment of epileptic seizures. Generally, we call it as epilepsy or fits. These are the symptoms of epilepsy. Epilepsy is manifested as a sudden loss of disturbance of consciousness and characteristic body movements. These characteristic body movements are called as convulsions. Some of the anticonvulsants drugs are phenazimide and gabapentin. These are the structures of phenazimide and gabapentin. Then the next is antitussives. Drugs which are used to suppress irritating coughs are called antitussives. Antitussives are the drugs that will reduce the frequency or insensitivity of the coughing. Noscapine and flocodine are the drugs for used as antitussives. Then anti-Parkinson's drugs. Before going to the anti-Parkinson's drugs, what is Parkinson's disease? Parkinson's disease is characterized by tremors, rigidity, and poverty of movement causing postural instability. The head and the other parts of the body shake uninterruptedly. These are the symptoms of Parkinson's disease. The drugs used for the treatment of Parkinson's disease are known as anti-Parkinson's drugs. They include levodopa and carbidopa. These are the structures of levodopa and carbidopa. Then last, selective modifiers of CNS drugs are neuroleptics. Neuroleptic drugs are also known as antipsychotics. Neuroleptics are a class of psychotropic medication which act on brain. Neuroleptics are used to minimize hallucinations, delusions, and facilitate social adjustment. The notable neuroleptic drugs are chlorpromazine, haloperidol, and loxapine. These are the structures of chlorpromazine and haloperidol. In this chapter, we discussed about what are pharmacodynamic agents, classification of pharmacodynamic agents based on the site of action in the body, acquired knowledge about drugs acting on central nervous system, and also understood the effect of different classes of drugs acting on the central nervous system. Thank you.